Hi everyone, my name is Shayan, and today I'm going to be talking about the effects of sugar-sweetened beverage consumption on obesity in vulnerable populations. So first, a little about me. I am a rising sophomore at the Nueva School in the Bay Area, California, and over the past few years, my interest in medicine and healthcare has really been at the forefront of the work I've been doing, whether through research or community-based initiatives, and more recently, the various applications of AI in medicine and healthcare. My specific area of interests include evaluating and improving the effects of social determinants of health in vulnerable populations, which is something that this presentation will be very centered around. Most recently, I have been selected to present my work at the 2024 Discover BMB conference and have been named one of the Toshiba and NSTA Explore Vision 2024 national winners. Over the past few decades, obesity has rapidly transformed into a global issue, even being labeled as a global epidemic by the WHO. Around 1 in 8 people are considered obese globally, which is around 13% of the global population. And this percentage is as a result of the rates nearly tripling over the course of half a century. And the worst part is that these rates have shown no signs of slowing down, but instead are continuing to grow at unprecedented rates. This figure from the Lancet depicts both the change in obesity rates from 1990 to 2022, as well as its current state as of 2022. In both charts, the US seems to be one of the countries most affected by obesity, and it is continuing to grow at some of the highest rates globally. Currently in the US, around 41.9% of adults are obese, which is the highest it has ever been, and around 69% of adults are considered obese and overweight, which is over 2 in 3 people. Additionally, these rates have nearly tripled as well since the 1960s and are continuing to grow. Looking at this, I thought the most effective way to tackle this issue would be through targeting a large cause of obesity and trying to mitigate it to help solve the problem. So after reading article after article after article about the largest contributors to obesity, I came across sugar-sweetened beverages, something that I've seen around me and almost everywhere that I go. First, what is classified as a sugar-sweetened beverage? Well, sugar-sweetened beverages include any drink that contains added sugar. Some examples being energy drinks, sports drinks, flavored waters, sodas, which is a really big one, sweetened teas and coffees, fruit-flavored drinks, and many more. So how do sugar-sweetened beverages contribute to obesity? Well, let's break it down and take a bottle of Coca-Cola, for example. We see that one of the main ingredients, in fact, the one with the second highest concentration, is high fructose corn syrup, a liquidized form of sugar, specifically corn syrup, that has a high content of fructose and has been proven to have significant ties with excess caloric intake. Many sugar-sweetened beverages contain high fructose corn syrup, but other common sugars include glucose, corn syrup, fructose, sucrose, maltose, and many more. Seeing this, I wanted to make a difference and help reduce obesity rates, starting with the US. But first, I needed to determine the target populations I needed to assess, and I chose 4: geographical region, race, age, and sex. I then used the CDC Behavioral Risk Factor Surveillance System, BRFSS 2017 dataset, in Stata, and performed various forms of univariate and multivariate analyses between these factors, along with obesity and sugar-sweetened beverage consumption in the past 30 days. After doing so, the results of my study showed several key insights on what populations had higher rates of sugar-sweetened beverage consumption. These were the southern region of the US, the American Indian and Black populations, younger age groups, and males. These results were very insightful, yet not very surprising either, when it comes to race. Through additional research, I came across the concept of racial residential segregation, something that was very present between the early and mid-20th century, and is defined as the separation of races through housing availability and resources, which includes the refusal of loans from bank-specific races in certain areas, which is also known as redlining. Because of this, districts with marginalized communities tend to be much more under-resourced, and this leads to fewer healthy options, leading to more fast food intake and therefore excess weight gain. Therefore, accessibility to healthy foods and effective policies must go hand in hand in order to fully help reduce obesity in these areas. A policy that I came across is sugar-sweetened beverage taxation, especially in it being implemented in just a few major cities, such as a few in California and only a handful of other cities around the nation. This tax would help reduce the accessibility of sugar-sweetened beverages in these affected areas and would be on average 1 cent per fluid ounce. Studies have shown increased attention towards sugar-sweetened beverage taxation over only the past half decade, and studies have shown that the impacts are effective. So, tying my own work to this policy, it would be most effective and efficient if this tax was implemented in populations that had the highest rates of sugar-sweetened beverage consumption, those of which are the South, Black, and American Indian populations, the younger age groups, and males. So, what can you do to help? There are several ways to contribute, such as helping elect policymakers who are aware of and plan to focus on tackling the obesity epidemic. You can also support local nonprofits in advocating for more attention towards this issue, or even, at a very basic level, spreading this knowledge to others, to family, friends, and anyone you find. Together, our collective efforts can drive change and help contribute to a healthier world moving forward. Here are the sources I used to create this presentation. And most importantly, I would like to thank Dr. Jelena Musharakic and Dr. Nadra Lisha from UCSF for their mentorship of my work. Thank you for watching. If you would like to contact me or learn more about my work, please email me and I'll get back to you as soon as I can.